All right. Can you tell me a little bit about how you found your way into gynecologic surgery?
Yeah, first of all, thank you, Cecile, and all your colleagues for inviting me to do this because, I think every year all of us that are SGS members kind of think about what the society means to us. I come from a UAB SGS lineage. Dr. Charles Flowers was president from 1986 to 87. My direct mentor, Dr. Ed Varner, was president 2011 to 2012. And I became a member in 2004 and was president 2013 to 2014. I think really early in my OB-GYN training, I really just recognized the importance of surgery and how surgery can really improve quality of life. I would say I was a little older going into medicine. I did a PhD first. So, I kind of knew the scientific process. And I would say my first memory was probably assisting, at least in the urogyn area. Really, we didn't have a urogyn division at the time as medical surgical gynecology. But my first memory was probably assisting Ed and team with doing a birch colpopexy. The mechanics made sense to me. The procedure made sense to me. Looking at her history ahead of time and understanding, urethral hypermobility and that and what this surgery was doing, that brought me all in. From there on, at every opportunity, I tried to talk about urogyn as I gave resident lectures and stuff like that as a resident, just because I really was excited about it.
Perfect. Tell me a little bit about what makes a good gynecologic surgeon.
So I think a good gynecologic surgeon is someone who is skilled both in the art and the science of surgery, and someone who thinks about individualization of care for patients. As I stated earlier, I think part of why I wanted to become a gynecologic surgeon is I sensed pretty early that there was a lot of not evidence-based approach, but a lot of expert opinion in terms of how procedures should be done. And, we would talk amongst ourselves, and this doc did things one way and this doc did things another way. And I think with my basic science research, my PhD background, I sensed a need for us, all of us as surgeons, to grow the science of surgery and get evidence that we could apply in an evidence-based manner to our patients. I'm really, really, I feel gratified and so humbled that I kind of feel like I was in the right place at the right time, in the sense that, I was involved with other surgeons at multiple sites, both urologists and urogynecologists, in both the urinary incontinence treatment network as well as the pelvic floor disorders network, which I think has rocked our urogynecologic world in terms of increasing understanding of pathophysiology, as well as applying those to our surgical approaches, fine-tuning those existed, coming up with others, as well as innovating in this area.
Great. So the theme of the upcoming meeting in March is surgeons as change agents. First, I'm curious as what that means to you, but then also I'd like to know from you what things have changed over the years and what you envision for the future.
Sure. I think that I kind of spoke to it previously with our, many of us being really early on. Again, we operated, we did procedures because that's how we learned. That's what you did when you took care of this condition in women. And I think, again, as being part of a change agent, you have to keep your mind open to new understandings, to new opportunities, to fine-tune surgeries, to increase our understanding through research, which I think 30 years ago, people dabbled in research. And I think now the actual research process is understood and the importance of it and adhering to it in a manner where patients are taken care of and appreciated for their role in advancing improved care as surgeons in urogynecology.
So shifting gears and talking specifically about SGS, what has SGS meant to you in your career?
I think, as I kind of opened, I've got a couple UAB, previous SGS presidents that I actually worked with, more so with Dr. Varner than Dr. Flowers. He was a very, very understanding and caring doc. Kind of had an edge as well, but he introduced me to the family of SGS, which I always felt was very welcoming. You played hard and you worked hard. And, the nighttime events were pretty fun. I mean, they also helped you grow in terms of talking about surgery and talking about topics that may have been discussed that day at the meeting, and just friendships that were made, and how people really valued friendship and collegiality. And not an environment of kind of competition in that. It seemed like it was a very open society. You could go talk to anybody. Everybody was welcome, would welcome you in that regard and answer questions. So I think that's what SGS has meant to me. I mean, I was president of OGS as well, which I'm honored to have done. But SGS just calls you back. And I really look forward to the meeting coming up in 2025.
Do you have, not to put you on the spot, but a specific memory from SGS that sort of either warms your heart, makes you laugh, or something that's important to you?
Yeah, I think I have many memories. Some I can talk about, some I probably shouldn't. But I had two that came to mind with this, kind of thinking about this. And I think I can remember the first oral I gave at SGS, which was quite memorable. And afterwards, I just remember people coming up and talking about the topic and asking my thoughts on various things, which was pretty cool. And the other memory I have is just walking around the meeting and looking in the rooms. And I remember one time, and I think I stated this to Tom Nolan when he interviewed me years ago. I remember seeing Linda Brubaker giving a didactic lecture and just thinking, this is an area that I love and I'm committed to, and I think I could do that too. So, and I'd like to do that. So those are kind of two memories.
This is my favorite question because I always anticipating the answer. Tell me what your favorite surgical instrument is and why.
Wow. Ever the vaginal surgeon, Cecile? The first thing I figured, whatever came to my mind first, I'm going to tell you, even though it may seem weird, but an Alice clamp. And like I say, ever the vaginal surgeon. Sometimes I'd need more. Sometimes you'd use it maybe for something other than holding back vaginal tissue. I'd kind of that was kind of my go-to instrument. It just seemed like it was something that I could use in an aggressive manner, but also in a nuanced, gentle manner. So maybe that's a weird one, but that's what came to my mind.
It's not a weird one, and I'm quite fond of the Alice clamp. I always have them clipped to the drapes.
Exactly.
I clip them because I use so many of them that I'm tired. I don't want to keep asking, so I just clamp them to the drapes, and I'm constantly using them.
Exactly.
So I think that's a great answer. The Breisky has been a lot of vaginal surgeons' favorite.
Absolutely.
But Fifi Parezzo loves the curved needle driver. But I think that the Alice is a great answer. Simplicity,
Awesome.
right?
That's right.